Hello, everybody. My name is Alex Drzezga. I'm the director of the Department of Nuclear Medicine at the University of Cologne, and I also work at the Jülich Research Center. My expertise is on imaging in neurodegeneration. And as you have noticed, there's an increasing demand for imaging tools in neurodegenerative disorders, in particular Alzheimer's disease, with regard to the novel therapies that are introduced and directed against amyloid in the brain. Biomarkers are essential today for diagnosis of the disease, for staging of the disease, and maybe also for therapy response. So nuclear medicine has a lot to offer with the tracers for amyloid imaging, for tau imaging, and also for imaging neuronal dysfunction with FDG PET. This is really a great opportunity to promote the excellent options of nuclear medicine imaging to integrate them into the clinical workup of neurodegeneration. However, there are also certain challenges in selecting the appropriate imaging tools with reimbursement, the discussion on the specific value of imaging versus the fluid biomarkers, the training of the involved staff, and also the communication of the results to the patients, the patient families, and the referring physicians. It is therefore crucial that we as imaging physicians are kept up to date with the evolving developments, the guidelines, the best practice guides, and other factors that are involved in the development. For this reason, the imaging exchange has been developed, which is a space for learning, discussion, and collaboration. We would be very happy to hear from you, questions, observations, and your real-world experience with imaging, which we would like to discuss. Please do not hesitate to ask questions. No questions are too small or too complex. This is really a space for shared learning. So engaging in the exchange may help you and your colleagues to gain practical insights and to improve patient care. We are really curious to hear from you so that we can all work together to advance PET imaging in Alzheimer's care.